I went into a military hospital and they started prescribing me Percocet. And from there, I took it quite often. And anytime that I had a Baker's cyst, anytime I would go back in, they'd prescribe, the prescription of it. And it's just started down a spiraled path. And it was just continuous until when I didn't have it, I didn't feel like myself. I didn't want to get up and take care of what I needed to take care of in a day. I just couldn't do anything. I couldn't function. And from there, I started buying them off the street. And they're expensive. But it still doesn't stop you just to feel right. You spend whatever you've got to.
You mentioned that you wanted to feel right. What does that mean?
When your brain starts to withdraw, you start to sweat. You feel like you can't get up out of bed. It's constant migraines. You feel like your head is splitting open. It's just awful. The pain is horrendous. It's horrible.
And by taking another pill, it would allow you to get back to normal.
I could get up. I could clean my house. I could do whatever I had to do in a day.
So you basically never would, from what it sounds like, you weren't taking pills to feel good, to get high.
No. Not after a while. Not after a while. After a while, it was just to get out of bed in the morning.
When did you know that you had a problem?
Probably 3 months after I had stopped taking them from the hospital and started buying them off the street. And one day we had a short check and couldn't buy them. And it really came out that I really couldn't get up and do anything for that solid week.
So was this while you were out west?
Yes.
Okay.
This is when it started. And then when I got here, it got a lot worse.
Because why did it get worse here? Is it because drugs are just easier to find?
Exactly. I don't think with Colorado Springs, it's as easy to get them, to be honest. I mean, they were not readily available.
But here, it's a cornucopia.
That's right. And I'm probably going to make a lot of drug dealers nervous right now with my name even being in the paper, but that's not what it's about. It's about you guys understanding exactly what happens, because a lot of times people don't understand how you really feel.
You mentioned you came back here and you knew it was an issue. You've been here for about 5 years. When did you go into treatment?
In 2015.
And where did you go?
Here.
Which is where? Because we can't tell from the video.
Am I allowed to tell them that? HCS. HSC.
HSC,
Yes.
which happens to stand for the Human Service Center.
Yes.
Okay. And when you went into treatment, were you on a methadone or a Suboxone?
I was on Suboxone.
Okay.
They had to put me into detox and start me up on Suboxone slowly. My habit was getting really, really bad. And I had gone through a divorce. I mean, it was all a horrible, dark mess. And my now husband pretty much gave me an ultimatum, like all drug addicts really come to after a long run. And he retrieved me the phone number for the Human Service Center. And I set up an appointment downtown by the hospital. And the first person I saw asked me how much I spent a day, which when you actually come to that realization, it is very scary. And for a long time, I even had a counter on my phone that added every day up of how much money I had saved, and I finally had to delete it. It was too much. But I went in and talked to this person, and they tell you to be completely honest and be straight up. And I was, and I let them know how much I was using, which was about 8,000 Vicodin every 8 to 12 hours.
So, and the average dose is
8,000 milligrams.
right of Vicodin. What is the
Yes.
average dose, you think?
The average regular prescribed dose is, if you are on 10 milligram of Vicodin, you've got a real bad.
Okay.
You better be standing in the living room with a broken leg. I mean, they don't prescribe it even then for any short reasons. So finding them is just, people do crazy stuff to get them. Whether it's, I've heard of people breaking their own arm to go into the hospital and get 10 milligram Vicodins.
Okay.
So after that, they gave me a phone number, and I started calling, and it was a check-in process. You have to call, say, this is my name, I'm calling and checking in for the day.
Wait list.
Yes, a wait list. And as soon as a spot opens up, they call you. It goes off of course, how bad do you want it? Well, let's see who's called and who's actually serious about this situation. And I'm sure the wait list person that took my name really was getting sick of hearing from me, and was very glad when I got help, because I was on the phone probably 2 times a day. But it's kind of, I hear a lot of people anymore say, I'm sick, I don't want to be on a wait list for that long, but if you really want it, you're gonna do it. You're gonna call in when you need to, you're gonna do what you need to do.
And how long were you on that wait list?
I don't think it was actually that long. It was
A
pretty
week?
quick.
Like a week?
2, maybe 3.
Now, were you having to stay clean, or were you using?
No,
So you were
I
still
was using
using
that
it.
whole process. Okay. And they called me and said, we can take you to detox right now. And I went, oh God, okay. I told my mom all of this, of course. My mom and dad are really behind me all the time in what I do. She's actually probably sitting out there waiting for me right this moment. But they've always been like that. They show up to every walk, everything. But she said, all right, let's go. And it was in that moment, you kind of sit there and fight back and forth with yourself and go, this is really happening. And you have to be sick for so long before you get Suboxone and detox.
It is what, 4 or 5 days, I think.
No, I was only in detox for 3 days.
Okay.
Everybody's going to be different. It's always going to vary, but I don't think
And actually,
I've ever.
we do office inductions now. So
Do
they're
you
here
really?
3 to 4 hours. Yeah.
I didn't know that.
Sorry for me.
I didn't know that.
Yeah.
That's
Yeah, they do it in
amazing.
the office now.
See,
There's
now
still
I'm
an
gonna
option.
feel like the OG now.
Yeah.
You have
There's
no
still the
idea.
option to go to detox
Right.
if it's medically necessary, but for the most part they do office inductions now that only take 3 hours.
And you are who is talking off the camera.
Yeah.
I'm sorry.
It's okay.
Chrissy Smith, I'm the program manager here.
And you do what?
So I'm the program manager at the Human Service Center Medication Assisted Treatment Programs. We do primarily methadone and buprenorphine here.
Which is
Both medications to treat opioid dependence.
and bup is and Suboxone is a form of
Suboxone's a brand name of
There we go.
buprenorphine combined
Okay.
with naloxone. Yeah.
Don't forget, we are talking to folks who have no idea
remember.
what you're talking about. All right,
I think Cecily's talking to folks. I was supposed to be listening. Sorry.
I know it's okay, and I do
You're supposed to
appreciate you're
be
fantastic.
Our rock star.
Yeah, she is a rock star, and she's also a big fan of the T-Rex. So, you were talking. So, what was it like ma'am, to go back and to do that detox. You had mentioned during your using days, you were buying pills off the street because you didn't want to feel bad. You know, where
Right.
it got to the point where you were taking pills to feel well. You weren't
Yes.
trying to get high. Now you were signing up for 3 days of hell.
It is, but it isn't. They slowly start to introduce you onto Suboxone, and Suboxone was like the godsend. It's
Why?
because I did not need that pill any longer to feel normal, to feel like I could get up. I take my Suboxone, and a lot of people, I've heard every argument known to man about medicated treatment. You couldn't introduce me to one I don't know. And it's so hard just to sit back and nod and go, well, you know, everybody has their opinion. But I have my experience, and I know that my family has me because of the Suboxone I'm on. That's all there is to it.
So talk to me about what it did, what it is. Is it a magic pill that you take and poof, I feel better, yay? Or is it something that you have to be weaned onto, ma'am?
Yes.
Or is it something that methadone, I hear, is still an opioid, much like bup is, but it doesn't make you high. It doesn't trigger those sensors. Does bup/Suboxone do the same thing? Can you talk about that, please?
Well, I can't. We can go down the path, like I said, of, I have to, you know. If I went through 3 brain surgeries last year. And we had to do breakthrough doses, is what they call it. And a lot of it is you have to get past those opiate receptors in your brain. And a lot of people don't like the breakthrough dose because it makes you feel a lot of it at one time. But I would rather have it to where I know I can trust myself. If there was a Vicodin laying on the side, that if I picked it up, I'm going to more or less probably make myself sick before I get myself high. Does that make any sense?
Mm-hmm.
So how does Suboxone work? If I remember right, Suboxone partially covers the receptors in the brain that are triggered by opioids. As a result, it sort of helps with the craving, but it doesn't make you high. But if you're taking opioids at the same time as Suboxone, you will actually go through some type of a withdrawal, I thought.
Not necessarily.
Not
Yeah,
necessarily?
no.
Okay. Could you maybe
premeditated-
explain that to me?
Premeditated withdrawal is not for the weak at heart. It is nasty. It will tear every piece of your soul and body to pieces.
Suboxone fits on the opioid receptors. It's what we call a partial agonist. So where an opiate or methadone might fully fit into the receptor, Suboxone partially fits in the receptor. So what it does when it does that is control the withdrawal that she might experience if she wasn't on Suboxone or an opioid, and the cravings. So what happens is it has a ceiling effect. So she could take, unlike methadone, she could take a ton of Suboxone, although I wouldn't encourage it. She could take a ton, and it's probably not going to make her feel high. It's going to make her sick before it makes her high, whereas methadone, you could get high. If you took enough of methadone, it doesn't have that ceiling effect. A person could feel under the influence. So Suboxone has that ceiling effect where she could take her dose or a little bit more than her dose, and she's not going to really feel any different. And like when she said she had her surgeries, our doctor had to work closely with her doctors because on her stable dose of Suboxone, a normal opioid or the normal medication they would give her in the hospital probably wasn't going to break through that dose of Suboxone. So they had to give her more to break through that Suboxone dose of the opiate.
So what you're saying is when she had her operation, to put it into terms that we could get, she was in pain. And to manage that pain, which is really the purpose of these pills.
Which we wanted,
and
even
they
though,
actually
yes.
work quite well at managing pain. She needed to take more than a typical dose for a person of her age and size because of the meds that she was on.
Yeah, to break through that Suboxone. Sometimes what they do too, and I don't remember if we did this with you or not, but sometimes the option is to stop the Suboxone. Did we do that with you? So we stopped the Suboxone for a little bit while she did pain management, because she needed pain management, right? She had brain surgery, but she still stayed connected with us, right, to make sure it didn't become an issue. And then once her pain was managed and she was able to come off the pain meds, right back on the Suboxone.
In terms of treatment, you mentioned that there's two different types. Actually, there are three, but the HSC does too. Who would get one and who would get the other, and why?
Okay, so we do an assessment anytime somebody comes into our assessment or our home office and they say, I have an opioid dependence and I need medication. We do an assessment to see which medication you're going to be more appropriate for, because although they work very similarly, they're different. Methadone requires daily dosing for a long time. It takes up to a year to even get a week's worth of medication out of the unit. Assuming that you even qualify for that. So a person has to be able to get to the clinic daily. On top of that, there's a set of guidelines for each medication that you have to meet. And so with Suboxone, it means that we're going to give you a week of medication at a time. So we have to be able to trust that you can medicate yourself with that medication, that you're going to do it responsibly, you're not going to share it with others, that you live in a household where you're safe and the medication's safe, that you have some recovery capital. She had supportive people, a safe place to live, transportation. So she was safe, the medication was safe. She was in a position where that was going to work. With methadone, it stays on the unit until you have take-home privileges. So,
and methadone is still, I mean, let's just put it out there, methadone is still a type of an opioid.
Yeah.
And the way it works is, if I remember right, it satisfies the cravings, but at the doses you are given, it does not make you high. But it is a maintenance drug. Once you are on that, unless you can figure out how to wean yourself off, you are on it for pretty much the rest of your life.
As long as you want to be on it. We have people successfully come off of it, of both medications. But yeah, both medications are considered maintenance medications. When you talk to somebody, I don't want to put words in your mouth, but when you talk to somebody like Cecily and you say, you're doing great, come off the medication.
That's
why? Well, why, right? I'm doing great. My life is going okay. There's no research that says I need to come off the medications, that it's unharmful to me, or that it's harmful to me. So why? But we have those conversations, so there's a lot of people that do want to come off the medications and do so successfully, slowly over time.
In terms of, one of the big things is, how do folks pay for this?
Mm-hmm. So our program is funded mostly by Medicaid and managed care organizations. So that's the majority of the funding for Suboxone and methadone. What's not covered by Medicaid or managed care is covered by formerly DASA, but it's called SUPER now, so basically the state and federal government.
I do a lot of my kids' parties, but honestly, it was really hard getting used to coming here, but after a while, honestly, it became my family, and I come to most of these people with my issues a lot of times, a lot more than I come to my family with my issues. And I know they've been sick, real sick, of seeing my face, but I mean, it's just, it became my family.
And when you say you come here and you talk to them, are you talking about, like, say, group, or are you talking about talking to folks?
All of it.
Okay. Is treatment here not just with the pills and the bupe and the wafers for methadone, but is there also a component to where you not only have to take the meds, but then you also have to come here and go through group or go through classes or go through yoga or whatever?
I've even done anger management.
Oh,
I've gone
really?
through classes of anger management here. I've dealt with grief loss with my counselors, from me losing friends, from me losing even down to my grandparents. I mean, if you could have seen my mental state 3 years ago, you wouldn't believe you're sitting and speaking to me today. It just is a complete difference. My counselor knows probably more about me than any human should, aside from myself. It's a dark path, but you get through it.
Could you have done this without these
No.
Boxstone? I mean, there is a tension out there between the pure 12 step groups who says, you want to know something, you gotta go cold turkey. And if you have a drink or you have a pill or you have a shot, then you are not sober. Even if you didn't get high or drunk, you happen to have used whatever your drug of choice is, poof, your sobriety stops and you start over. There's another school of thought that you have to use some type of a crutch, and if it means you have a drink every once in a while, fine. If it means that you have a Suboxone, whatever it is, you do what you have to manage what you do.
Right.
In your point of view and in your life, could you have gotten over your addiction? I'm sorry, could you have managed it the way that you are now without the pills and without all the stuff here?
That's a really hard question.
Thanks.
I think I could have managed to get off of it, but do I think because recovery, everybody sees, a lot of people see recovery different. And is recovery getting off pills and okay, you're clean to live your life and you're doing well? Or is recovery the mental health that you get while you're getting clean? I don't think I would have managed as well as I have now without the people that helped me along the way to do so.
But what about the pills you were taking? How vital was that
It was huge.
for the Butte? How vital was that to getting to the point where you could have worked on your mental health? Because you said I could have gotten off the pills.
Right, but I don't think, honestly, I would have done as well staying off without my Suboxone. My Suboxone was a big thing and still is. I mean, that's where I'm on my way to as soon as I walk out of here, is to pick up my prescription and go along with my day. It's just like any medication. It would, and I know this is controversial, but would a very depressed person be able to stand up and go along with their day without their depression medication? Yeah, probably, maybe. We'll never know that. But because they have that mental stability and that help, they'll probably do a lot better.
How vital is Suboxone and methadone to helping folks? Yes, there are some folks who don't need it. There's some people who maybe could go cold turkey. Opioids, I've been told by you and others, are different from other types of drugs. There actually is a physical, not just an emotional or a mental component. Could you maybe talk about that?
Yeah, I think that the majority of opioid users would not stop, opioid addicted users would not stop using opioids without medication assisted treatment. And not only would they probably not stop, but their long-term success really, I think, would depend on it. So what I heard her saying was, could she stop using the pills? Probably not, but maybe. Right. Maybe I could have. Would I have stayed off the pills and lived the life I'm living now?
Exactly.
Probably not. So could people cold turkey and stop? Maybe. Probably not, but maybe. But their long-term success would struggle, I think.
I mean, there is a controversy in terms of treatment. It's very pricey. It's expensive. It works some of the time. It doesn't really work all the time. People have to want it and do whatever. So what I guess I'm asking you is, how important is it?
Yeah, I want to be clear, too, that people obviously don't have to do MAT to get clean. I think that with or without MAT, it takes a level of motivation and commitment that Cecily has that I think people need to succeed. So medication-assisted treatment definitely helps. And it helps people get through the withdrawal and get through the craving so that they can manage some of the other parts that we know are important for recovery. But medication-assisted treatment isn't a quick fix either. It takes commitment and motivation. And like Cecily was saying, with methadone, it's daily. I mean, you have to get here daily for a long time. She was required to get here a few times a week for group and individual counseling, and at least once a week to see the nurse, and then to pick up her medicine. And so it's not just an easy, I'll take my pill and move on. I mean, it takes a level of commitment and motivation. And so I think whether you do it with MAT or without, you have to be at a point in your, use that you're ready to do something different.
So basically, you have to hit bottom.
Well, yeah, whatever that bottom is, I think it's different for people, right? I mean, we have this idea that rock bottom must be the worst of the worst, right? Like I'm living under the bridge, or I've lost my kids or my family or whatever, and I think that is bottom for people. But it could be anything, just anything that sparks your motivation for a different life, to do something different. And, some people find that in the 12-step community. Some people find that in the church community or just with family. A lot of people with the opioid use disorder find that with medication-assisted treatment. In
terms of, we were talking, how prevalent is it here in this area?
Super prevalent. I mean, super prevalent. We have, in this area alone, we have 3 methadone clinics that serve roughly 1,000 people, and that's not even covering everyone, right? There's still waiting lists. We have buprenorphine clinics.
Which is
Suboxone.
Right.
Yeah, so Suboxone clinics, that's covering, I don't know, somewhere around, we'll say 500 people maybe. And we still have waiting lists and people struggling and people using actively.
And then, of course, there is the third option, which is, could you explain that?
Vivitrol?
Yeah.
Yeah. So Vivitrol, the Human Service Center doesn't do Vivitrol a lot. We have done Vivitrol. There's pros and cons out there with Vivitrol. The part that we struggle with is the idea that there has to be a period of time of no use to be able to qualify for the shot.
Which it happens to be 7
to 10 days. And the majority of our people struggle to stay clean for 7 to 10 days at a time. And so the majority of people I see are more appropriate for Suboxone or methadone. But we do, Vivitrol is an option, and it's an option that some people do in the area. But I'm not familiar with how much it's done, but it is done.
And that is a drug where once you take it, it blocks completely the receptor.
Yeah, it's an injection, or it can be done orally, so it can be done in a pill form, which we have done often in terms of MAT for alcohol. We do that for alcohol, the pill form, but it can be pill form or injection. Vivitrol is the injection, the brand name for the injection, and essentially it works just like methadone and Suboxone, where at an appropriate dose, it blocks the cravings and controls the withdrawal.
But I thought that also, it completely blocks it. So if you take an opioid, you will get sick. In other words, it will send you immediately into withdrawal, I thought.
I don't know that about
Vivitrol. No, that's what I heard. I'm not saying that's true.
No,
all right. So, talk to me, we're talking about all this stuff. How there's some people who say that there's a lot of docs who say that this is the same thing as people who have diabetes. They have to take a pill, or they have to take insulin, and they are fine. It is a maintenance drug. Mm-hmm. Your thoughts on that? Are these meds on the level of that?
Yeah, I think so. What we know about addiction is that addiction is a brain disease, and we know that it changes the natural function of your brain, just like depression does, just like diabetes changes the natural production of insulin. And we know that there's medications out there that can control that. And so that's what methadone and Suboxone do, is it kind of realigns those receptors and those feel-good chemicals in the brain so that somebody can function normally.
What is your life now compared to what it was?
It's night and day. I have relationships with my family that I didn't have for a really long time. I have a relationship with my kids that went away to the wayside for a long time. I have relationships with people around town that knew me as a drug addict. I mean, it's completely different from what it was, for sure.
And what do you think, and how, and I think I touched on this earlier, but I want to ask, how important was coming here and going through the Suboxone for that?
Oh, it was huge. It was what initially, as I see it, as my opinion, saved my life in the end of it. I was on the very verge of heroin before I walked into this clinic.
And thank God you
Right.
didn't make it.
I'm one of the very lucky few that got out before my foot was in that grave.
So now you are 30. Well, that's not young. That is also not old. But you look at some of the clients that come in here. There's a lot of young folks. What advice do you have for any parent or anybody who is going to watch this?
You can change anything as long as you do what you need to do to get there. If you want to take the medication and just go on with the way your life has gone, I guess that's an option and that's what you're going to do, but you're not going to make it very far. If you put in the work, you put in the time and the effort into getting your life together, that's what you're eventually going to come to. It's all about, I mean, with anything, it's effort. It's how much you want to put into something.
You know, a lot of people, I think, believe that MAT, medication assisted treatment, is a quick fix. And as she's talking, I'm sitting here thinking, I wonder how many people in our waiting room would say, oh, this has been easy. I don't know that many of them would say this has been easy. I mean, this is just as difficult a path as any. The only difference is maybe they didn't white knuckle the withdrawal, right? I mean, they still had to put in a lot of motivation and effort and commitment to get where they're at today. I guess something that I would say to family is try to be as supportive as you can. Try to get in and talk to the counselors and educate yourself on the process. Because I think once people meet us and talk to us and hear what's really happening here, they're pleasantly surprised.